Hello, Diaz here, founder and owner of Greenwood Dental. Welcome back to my videos. Today's video is about implants. I will be answering a couple of questions that we've been getting from a lot of our patients, even coming through the office. Yes, we have started to place implants. The implants are placed by one of our associate, Dr. M, known as Dr. M. And she will be the one that to do the CT scan, which is 3D imaging that happens in our Burlington office. And she'll be analyzing the site and approving you or any patients for placing an implant. As of now, she's only doing back molars and the premolars. The premolars are the teeth between your canines and the molars. She's not yet doing anteriors. She just thinks that she's a little bit more comfortable starting on that first. Yes, we will refer obviously some cases to the oral surgeon. I mean, remember, we are general dentists, so there are certain cases are beyond our expertise. So we're very humble about that, to say that, this is really beyond what we have seen, we've done, and we will be referring you to the oral surgeon if we think it's the case might have complications, or you might be better off with a handling the case with an oral surgeon. Not because if it's, we're not capable, it's just you're better off since the site is questionable or the outcome is questionable, because we don't have that kind of experience. They do implants as fast and as often as I do fillings. I do a filling like in 3 minutes. So that's what they do every single day. So don't be, fussy about if we say, we can't do the implant here and you need to go to oral surgeon. I know it's inconvenient to go to another office, and really appreciate that you guys want to stay with us. But at the end of the day, it's very important for you guys to get the optimum, of treatment. And this should be a good thing that we admit that it's beyond our expertise and not we can do everybody. The overconfidence, the over optimism, I worry about that, and my associates are very good at, knowing, the limits. I've been doing this for 20 years and I always, I know my limits. So the process, you get the CT scan, you get evaluated by Dr. M, then they do a lot of work behind the scenes, contacting the implant company. We did BioHorizon. That's the type of implant we place, which is equivalent to a Straumann, if you want to Google that. The same system. And then she will get more information about, the guide. There will be a clear guide where exactly the implant drops. I did assist her when an implant, literally it took 15 minutes. The technology is amazing. The evolution of the technology is amazing, and she's very, very confident and very, very comfortable with it. We have done a couple of cases already, and they are very, very successful. And honestly, with the technology of the implant, the failure rate is almost non-existent. So yes, we do implants. However, you need to get evaluated by Dr. M. So if you have any questions, give us a call, reach out to the office. They'll guide you through, they'll check your insurance with insurance verification. Remember, the implant, when you drop the implant in the bone, we don't touch it for about 3 months. We don't load it. Loading meaning that we cannot put a crown on it until it goes back to Dr. M, and she has to torque it and make sure the fusion between the implant, titanium implant, and the bone have taken. It's 100% successful. Then it's ready to put the crown on. Just like putting a plant in the dirt, we need to make sure that the roots are nice and strong before you hang stuff on it, something like that. So yeah, if we are, hopefully that satisfied the the inquisitive tendency about the implants. We do implants, and we're very, very excited, because that means that our practice is growing and we can serve you more, and make your experience as expected, or we can meet expectations as much as possible. So I'm out of time again. This is a really quick one, but depending on what kind of questions, the most common questions, most frequent question, I will do another video about it. And we love you. Be safe. I'll catch you on the next video, and DS out.